थैंक यू अमित. खाने के टाइम में पढ़ाई करना अच्छा विद्यार्थी का पहचान है. Basically, we all are aware that this era of this modern era is basically now accident has become epidemic, and this does not occur only at workplace. This also occur at your household place also. You can see in many type of injuries, including the eye injuries are many a time not isolated. They are associated with uh, head injury also in a road traffic accident or in mechanical injury accidents. So one should not think that eye injury is alone. So you will have to evaluate the patient in toto, whether the patient is conscious or not, whether the patient is cooperative or any other systemic problem with them is not. So before you examine the eye properly, you must evaluate the whole uh, patient as a whole, so that you have better knowledge about the uh, prognosis and way of management. So this should be taken as a whole, and associated or suspected structural damage must be explored. Most common injury in a lead injury is associated mostly with injury of the orbit as well as face and the globe itself. So uh, you have to be aware that this might be harboring globe injury. So whenever, never try to open it forcibly. If it is not possible to examine the eye globe normally, then examine the eye globe under anesthesia only. And since we know that all facial injuries bears a cosmetic uh, problem with this, and it has a medical legal implications. All facial injuries with permanent disfigurement constitute to grievous injuries. So this should be recorded photographically as well as in a written form diagrammatically. And at the same time, you must at least do so one either of CT scan or ultrasound or X-ray to find out whether there is any fracture or foreign body lying it or not. So after that, you take primary care. So this, if you find that there is only lead injury, this can be taken up uh, separately, and dirty wounds are taken after cleaning and disinfecting. Even injury with animal bite is supposed to be a dirty wound, apart from injuries which have foreign bodies in itself. And so the vaccination status should be taken for. And if the patient is if you suspect that rabies may be there, so vaccination should be taken care for. And if it is beyond your scope for management of lead injury, always do a referral, and but before doing referral, the wound should be cleaned and debrided, and primary stitches can be applied for appositions. Means where you will find that the lid tissue is not in position, it has gone somewhere else, so you will have to explore the lid area and make the logical appositions of the skin and lid. And antiseptic dressing and vaccination should be done, especially for tetanus also, and preventive antibiotics should be started. Drying of the wound margins should be avoided, and when more skill is needed, like flap rotation and cutler beard, this should be, you can send to some more experienced surgeon. Success of eyelid repair depends on proper placement and satisfactory suture tension. Lid margin repair is very important to prevent exposure keratitis and maintain the tear film, normal tear film. And post-operative notching of the margin should be avoided because it will cause exposure as well as corneal ulceration, etc. And if you find that the edges of the wound is ragged, then you will have to freshen them so that apposition is good and which can be taken for primary healing. And pentagonal defect is created when tarsal plate is ragged, because tarsal plate in principle it has to be parallel to each other while suturing each other to the suturing of the lids. Otherwise, there will be notching, and this should be stabilized by external stay sutures like frost stitches at the end of the surgery. And superficial lacerations are very easy. Anyone can do it, and smallest calibers suture should be used, and needle should be cutting needle. It could be either vicryl type of things or natural, even thread can be used, or silk. And final wound edges should be slightly everted. For deep laceration, you must think that it might be harboring some foreign body, and there might be injury to the septum, and there might be injury to the LPS also. And injury to the septum and LPS should be repaired separately, and this should not included into the while suturing the eyelid repair. Otherwise, this could lead to leg ophthalmos. So this should be extra precautions should be taken care of. If you find some fat, it means there is septal injury. And after this surgery, if there is ptosis, that is we call it secondary ptosis, don't try to repair this at the same time. You can take, it can be taken after say 9 to 12 months after that. And the basics of injury repair can be seen here. You see that there is a ragged margin, it has been freshened up, and first lid suture in the center is given with a stronger suture material like 60, and after and the lateral 2 are given by 80 of vicryl type of things, and then the first it is opposed and tightened in such a way that there is some eversion of the margin, and then inner this is repaired in is 2 layers, that is inner tarsal layer and then skin layer. And like this you can use. This is not a very difficult thing, but you must care that the tarsal plates are parallel to each other after, so that this is called pentagonal structure. And then after repairing this, a stay suture to the opposite side, that is we call it frost suture, is given for better healing. And since it's very difficult to show it in pictures during the operation, so but the basic principle was this. And when there is tissue loss, you need to create tissue. Lid is very elastic, so around 25 to 30% of case loss can easily be managed with direct closure, especially in older age group. But when there is some shortage of the tissue, the simple method of cantholysis with direct closure can be used, and if it is more, you can use Tengel or Cutler beard. So here this is the basics of cantholysis. You remove the skin here and then expose the canthus. The incision is given here, and then this is cut inferiorly, and some type of relaxing skins undermining of the skin tissue is done, so that it becomes mobilized, and this can be stitched like this, and then canthal repair can be done. For larger tissue loss, we can go for cantholysis as well as Tengel, and this can be achieved good deposition for when slightly 60 to 70% loss is there. Similarly, for when the upper lid is lost, when the still the tarsal plate, some part of tarsal plate is there, you can use this rotation flap from lower side, and this can be fixed, and this can be managed easily, and again new canthus is made here. Upper lid defects with tarsal plate missing can also be taken by Tengel flap as well as Cutler beard. Here you make a this bucket type of handle in the lower lid, and tissue is mobilized from lower side to upper side behind the lower lid tarsal plate, and then it is stitched in the upper lid. And after 1 month or more, you can cut it from here and remove the suture and then stitch this lower lid here. This will give a good cosmetic look as well as need for good normal lid. Since it is upper lid, so you may not have a need many a time tarsal plate again here. But if you think that there is chance of floppy upper lid, you can always take a cartilage from auricle or nasal septum and place in between this. People are placing some type of plastic or buckle type of thing for this, making this artificial tarsal plate also. And at the same time, if you find some canalicular injury and you don't have
sir, canalicular injury will be.
I am not imposing, आपके लिए रास्ता बना रहे हैं. So before referring to Dr. Ravi Ranjan, just he will find something difficult while finding out canaliculi. So you thread 20 catgut or vicryl in the canalicular end, and then just thread and give a stay suture, and then we'll write a good letter to Dr. Ravi Ranjan to make it better. And with this, I say thank you.
For excellent presentation, sir has beautifully explained all the methods, and especially for PG when they are in emergency and they suture these lacerations. So following all these criteria for especially lid margin suturing is very important, and how defect has been created and it should be